Well, we got the flu season. It is right around the corner, so it's actually best, I understand, to get vaccinated now before the season starts. This is Dr. Ryan Kissane. He joins us with more on the importance of getting vaccinated. Good to have you here today.
Yeah, thanks for having me. I appreciate it.
Well, tell us about the flu vaccine. I've heard a little bit of controversy. I believe we had a story yesterday about should mothers that are pregnant, should they get the flu vaccine?
Yes. So the flu vaccine is safe for mothers who are pregnant, and actually in the first, the second, or the third trimester, the flu vaccine is safe.
Still safe?
Yeah, still safe with pregnant women.
So who is most, is it the young and the elderly that are most at risk of catching the flu typically?
So the most at-risk groups that we worry about, any healthy individual can still contract the flu illness, but we worry about infants, we worry about the elderly population, 65 and older. Worry about patients that have chronic comorbid conditions. So people who have COPD, asthma,
breathing
congestive
issues,
heart failure, diabetes, those different groups, if they do get the flu illness, the effects of getting the flu are a little bit more severe in those groups than a healthy individual that has a robust immune system.
Well, what do you say to people when they say, I never felt sick until I got the flu vaccine?
Okay, so this is a common misconception.
Yes.
There's a couple studies, randomized controlled clinical trials, where they compared the flu vaccine, people getting the flu vaccine, and another group that is just getting normal saline or salt water, the placebo group. And they found no statistical differences in those groups reporting that they got illness. What they hypothesize is that people are actually just getting the common cold, by coincidence after getting the flu vaccine, and they say, hey, I got sick after getting the flu vaccine, when in actuality they got, rhinovirus or adenovirus, which is a little bit more mild like the common cold, but they're actually not getting sick from the flu vaccine.
I got you.
Yeah.
Well, is there places they can go? I think a lot of places offer the flu vaccine for free, right?
Yeah, absolutely. So there is some clinics that offer it for free. We advocate that all patients out there, especially right now before the flu season starts, which is October to May, to go ahead and get vaccinated. But CVS, some Walgreens, you can go there. They usually have a nurse practitioner that's on staff where you can get the flu vaccine. Some are free, some you got to pay a small fee. They accept insurance, and if not, then we, advocate that you go see your primary care physician to get vaccinated to protect yourself. Okay,
well, Dr. Kissane, we're out of time on this, but thank you very much for coming and for all the info.
Thanks a lot. I appreciate it. Thanks for having me on.